Welcome to this explainer. There are a few things out there as downright scary and disorienting as being newly diagnosed with debilitating dizziness, earfulness, or this constant ringing in your ears. When the world just suddenly starts spinning, or a loud, unexplainable noise completely takes over your hearing, it's entirely natural to feel overwhelmed. So today, we're going to act as your personal specialist. We're taking the mystery out of two of the most common, yet literally most frequently confused causes for these symptoms, Meniere's disease and vestibular migraines. Let's get into it.
The very first crucial step here is figuring out exactly what it is you're experiencing. Are you feeling vertigo, like that intense sensation that the whole room is spinning around you? Or do you have ear ringing, which is also known as tinnitus? Or is it maybe a mix of both? Because these overlapping symptoms, they cause intense confusion, not just for patients, but honestly, sometimes even for healthcare providers. So teasing apart exactly what you feel, that's step one to getting your life back on track.
So, here's our roadmap for today. We're going to start with the dizziness dilemma. Then we'll look at Meniere's as an inner ear fluid issue and migraine as brain hypersensitivity. Next, we'll dive into the silent migraine mystery, compare your unique triggers, and finally go over tracking symptoms for doctors.
All right, Section 1, the dizziness dilemma. Let's understand these overlapping symptoms.
As a specialist, I constantly see newly diagnosed patients totally confused by these two distinct conditions, mostly because they share this incredibly unsettling intersection of dizziness and ear-related symptoms. But to navigate this fork in the road, I want you to think of your body kind of like a house. Meniere's disease, that's basically a plumbing issue. It's driven by a buildup of fluid right in your inner ear. Vestibular migraine, on the other hand, is more of a software or wiring issue. It's a neurologic hypersensitivity happening deep in your central nervous system. So both are going to make you dizzy, but the mechanisms behind them, they couldn't be more different.
Which brings us to Section 2, Meniere's, the inner ear fluid plumbing issue.
So Meniere's disease is a condition that usually pops up between the ages of 40 and 70. And understanding how this plumbing actually backs up is absolutely key here. See, there's this built-up inner ear fluid called endolymph, and it directly causes these really specific fluctuating ear symptoms. Because the plumbing is all backed up, patients experience immense pressure. This leads to a feeling of intense fullness in the ear, noticeable hearing loss, especially in the lower frequencies, and these long dizzy spells that can drag on anywhere from 20 minutes to 12 hours. It's a problem heavily localized to the physical environment of your inner ear.
Moving right along to Section 3, migraine. This is the brain hypersensitivity, or the wiring issue. Now, contrast that plumbing problem with our software issue, vestibular migraine. This one actually tends to start a bit earlier in life, and we see it a lot more frequently in females of childbearing age. These episodes happen because of neuroinflammation. Basically, molecules in your body like CGRP make your brain intensely hypersensitive to everyday sensory input. It's literally a software glitch turning totally normal signals into debilitating symptoms. And look at the duration here. Episodes can be a quick 5 minutes or drag on for an agonizing 72 hours. Plus, notice the extras: sensitivity to light and sound, visual auras, even neck pain. Your brain is just overreacting to absolutely everything.
Okay, Section 4, the silent migraine mystery. Yes, migraines without the actual headache.
This concept is a real game changer because it completely shatters the myth that a migraine always equals a terrible headache. We call it the silent migraine. It's an atypical variant affecting about 4% of migraine patients, and it is heavily involved in vestibular issues. This is where you experience intense sensory sensitivity. We're talking the dizziness, the visual auras, the ear ringing, but completely without head pain, zero headache. This is exactly why so many folks get misdiagnosed. They tell their doctor, but I don't have a headache, so it can't be a migraine, right? Well, actually, yes, it absolutely can be. What you really need to know is that seemingly unrelated physical feelings are actually massive clues. Things like neck stiffness, facial or sinus pressure, and earfulness. Those act as massive neurological red flags for this variant. So if you're dizzy and your neck feels incredibly stiff, your brain's software is likely misfiring. That points strongly away from a plumbing issue in your ear and heavily toward a silent migraine.
Let's jump into Section 5, comparing your unique triggers, specifically around environment and diet.
Identifying your specific environmental and lifestyle triggers, that is the master key to getting your life back. And when we compare the two conditions, we see a really stark contrast. Because Meniere's is a fluid retention issue, its main trigger is dietary, specifically high sodium intake. But vestibular migraine, because that's a software hypersensitivity issue, it gets triggered by systemic stressors. Think lack of sleep, high emotional stress, overwhelming sensory environments, hormonal drops, and yep, even shifts in the weather and barometric pressure.
To really cement this contrast, let's think about diet. High sodium pulls fluid directly into the inner ear, which immediately impacts the plumbing for Meniere's patients. But then consider things like high sugar intake or heavy caffeine use. Those things spike neuroinflammation and trigger brain hypersensitivity for migraine sufferers. It's a prime example of why you have to feed the right diagnosis with the right diet. For instance, if you and your doctor suspect Meniere's, managing your inner ear plumbing usually starts right at the dinner table. Limiting your sodium to around 1,500 milligrams a day is very often the first, least aggressive management strategy that clinical guidelines recommend. Doing that helps stabilize that endolymph fluid we talked about, and it can drastically reduce the pressure and those terrifying vertigo attacks. All right, Section 6, Tracking Symptoms for Doctors. It's time to empower your diagnosis. Because here's the thing, you do not have to be a passive participant in your diagnosis. Here is a concrete action plan to help your doctors accurately differentiate between a plumbing issue and a software issue. You've got to map your personal symptoms. Step 1, track what you eat, for sure, but also track the weather and your stress levels. Step 2, write down if you feel neck stiffness or facial pressure right before you get dizzy. Step 3, honestly, use a stopwatch. Does the dizziness last 10 minutes or 10 hours? That timing is absolutely critical. And finally, step 4, hand this structured diary directly to your specialist. Trust me, it is pure gold for getting an accurate diagnosis. I want to leave you with this final, really powerful thought regarding these diagnoses. Whether it turns out to be a plumbing issue like Meniere's or a software issue like vestibular migraine, identifying the true pattern completely changes everything. Once that true pattern is recognized, do you see how much more effective and hopeful your management plan can actually become? If you could map out the hidden software glitches or plumbing leaks in your own body starting tomorrow morning, how much sooner do you think you could finally reclaim your life from dizziness?